Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Blood in urine hematuria in males. Blood in urine hematuria in males has many causes, including an enlarged prostate, urinary tract infection, kidney stones, and injury. /r/n/r/n hematuria may be visible to the naked eye or only be detected with urine tests. While the cause is often benign, not harmful, blood in the urine should never be ignored as it may be a sign of a serious medical condition, cancer included. /r/n/r/n This article explores some of the common and uncommon causes of hematuria in males. It offers an overview of how the conditions are diagnosed and treated, as well as when to see a healthcare provider. /r/n/r/n Urinary tract infection, UTI, is the most common cause of hematuria, particularly infections of the bladder. /r/n/r/n A urinary tract infection happens when bacteria from the gut enter the urinary tract through the urethra and infect the bladder. More than 80% of urinary tract infections are caused by the bacteria Escherichia coli, E. coli. /r/n/r/n Symptoms of a bladder infection include /r/n/r/n hematuria occurs in at least 88% of cases of urogenital trauma. In males, the urogenital system includes the kidneys, ureters, bladder, urethra, penis, and testes. /r/n/r/n Top causes of blunt injuries to these parts include deceleration, when a vehicle stops suddenly, gunshot and stab wounds, falls, and sport-related impacts. /r/n/r/n In addition to hematuria, a male with urogenital trauma may also have other symptoms of trauma, such as /r/n/r/n Symptoms of a kidney injury may include hematuria as well as /r/n/r/n While having a large amount of blood in the urine is more frequently associated with major injuries, it is possible to have a major injury with only a small amount of blood in the urine. Thus, any amount of blood in the urine following an injury should be treated as a medical emergency. /r/n/r/n Benign prostatic hyperplasia, BPH The medical term for an enlarged prostateis, a condition in which the prostate gland grows bigger. /r/n/r/n Symptoms of an enlarged prostate include /r/n/r/n BPH is not cancer, nor does having BPH increase your risk of cancer. BPH becomes more common with age. In fact, more than 90% of males over the age of 80 have an enlarged prostate. /r/n/r/n Kidney infection, or pyelonephritis, is usually caused by a bacteria that infects the kidneys. It can either be an acute, short duration, infection, or chronic, lasting 3 months or longer. /r/n/r/n Most kidney infections are caused by the bacteria Escherichia coli, E. coli, which normally lives in your bowel. The infection usually starts when the bacteria enters the opening of the urethra, then moves through the urinary tract, infecting the bladder, then the kidneys. /r/n/r/n Kidney infection may present with the following symptoms: /r/n/r/n Kidney stones, known medically as renal calculi, are hard deposits made of calcium and urate crystals that form inside the kidneys. In males, calculi can also develop within the ureters and bladder. /r/n/r/n The main symptoms of kidney or bladder stones include /r/n/r/n Kidney and bladder stones can be brought on by a variety of things, including infections, trauma, medication poisoning, enlarged bladder veins, varices, and drinking too little water. However, it's not always clear why calculi form. /r/n/r/n Hematuria can sometimes occur following a high-intensity workout. In most cases, hematuria lasts between a few hours to 3 days after the intense workout ends. If it lasts longer, another underlying cause is likely at play. /r/n/r/n. According to a study in the journal Renal Failure, out of 491 people who went on a 5-kilometer run, 12% developed hematuria, most of whom were under the age of 30. Also, 81% of people with hematuria were hematuria-free within 3 days. /r/n/r/n. Although endurance exercise, such as long-distance running, is a risk factor for hematuria, researchers in this study concluded that hematuria is more often related to the intensity of a workout rather than its duration. /r/n/r/n. Apart from blood in the urine, exercise-induced hematuria is not known to cause other symptoms. /r/n/r/n. Cancer of the bladder, kidney, or prostate can cause blood in urine in males. Hematuria happens when a tumor grows on the affected organ, weakening nearby blood vessels until they rupture and bleed. /r/n/r/n. Bladder cancer is the most likely form of cancer to cause hematuria. However, prostate cancer is the most common cancer in males. Hematuria is often seen in people with advanced prostate cancer, stage 4, nearly half of whom require medical treatment to control the bleeding. /r/n/r/n. In addition to hematuria, other common symptoms of cancer in the urogenital tract include /r/n/r/n. It's important to note that many males with prostate cancer do not have any symptoms at all. For this reason, males between the ages of 55 and 69 should consider routine screening for prostate cancer under the guidance of their healthcare provider. /r/n/r/n. Other possible causes of blood in urine in males include /r/n/r/n. There are several rare diseases and genetic disorders that can cause blood in the urine. /r/n/r/n. There are a number of tests that, when combined with a physical exam and medical history, can help your healthcare provider identify the cause of hematuria. Urine and blood-based tests used to diagnose hematuria include /r/n/r/n. Depending on the suspected cause, other tests may be ordered, including /r/n/r/n. The treatment of hematuria is directed by the underlying cause. Treatment of some of the more common causes include /r/n/r/n. Medications that cause hematuria may also need to be substituted or have their dose adjusted. /r/n/r/n. The most common cause of hematuria in men is a urinary tract infection, while other less common causes include heavy exercise, benign prostatic hyperplasia, or an infection elsewhere in the male genital system. Testing urine for the presence of blood is helpful in determining the cause of hematuria. Depending on the cause, an antibiotic may be all that is needed, but other medications, procedures, or surgeries may also be recommended. /r/n/r/n. It is important to note that the amount of blood in the urine has no correlation with the severity, or lack thereof, of the underlying condition. /r/n/r/n. For this reason, if you notice even a small amount of blood in your urine, you should contact your healthcare provider right away for a diagnosis. /r/n/r/n. Depending on your other symptoms, your provider may refer you to a specialist in the male genitourinary tract, known as a urologist. /r/n/r/n. You should also see your provider right away if you have any new or unusual symptoms, including /r/n/r/n. Blood in the urine, hematuria, is common in males. It is frequently caused by conditions like an enlarged prostate, urinary tract infections, epididymitis, orchitis, bladder or kidney stones, bladder or kidney infections, and certain medications. /r/n/r/n. Less common causes include glomerulonephritis, lupus, genetic disorders like sickle cell anemia, and cancers like bladder cancer, kidney cancer, and prostate cancer. /r/n/r/n. Hematuria is diagnosed with a physical exam, a review of your medical history, and urine and blood-based tests. Based on the suspected cause, imaging tests or an intravenous pyelogram may be ordered. The treatment of hematuria is directed by the underlying cause. /r/n/r/n. rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.